my name is Xavier Leleu. I'm head of department, professor of hematology in Poitiers, in France. I'm an IFM board of director member. At ASCO and EHA 2025, I've been interested to present the IRAKLIA study results. The IRAKLIA study results on behalf of all my co-authors, the Sanofi pharmaceutical companies, the patients and their families, is a phase 3 study, multicenter, international, with the objective to show the data we have obtained with Isatuximab, CD38 monoclonal antibody, on its subcutaneous flat dose 1400 formulation, with a real new way of giving a subcutaneous formulation to patients. So IRAKLIA is a phase 3 that will compare Isatuximab, Pomalidomide, dexamethasone, Isatuximab Subcutaneous with an on-body delivery system, sort of an on-body device, compared to Isatuximab Pomadex, Isatuximab being IV. So here are my disclosures. And the new thing here is really about the on-body injector. Usually when we use subcutaneous formulation, we use manual push. The daratumumab is given with a manual push subcutaneous formulation. Here, you're not going to use a manual push anymore. You're going to use this device that you can see on the picture. We call it an on-body injector, on-body delivery system. It's hands-free. The needle is hidden. It's a very tiny needle, much more tiny than usually we give to subcutaneous manual push. It's really harmless. There is no hyaluronidase. The 1400 flat dose of Isatuximab will represent a 10 milliliter volume, and it is individualized because it takes into consideration the thickness of the skin and the interstitial tissue, and it administers the product very smoothly according to the thickness of the skin. And so this device, as you can see here, gonna stick it to your skin, then you can do whatever you want, as long as you probably don't parachute, but for the rest, you stick it to your skin, you push on the button, it's all automated. So really, it's an absolute groundbreaking paradigm shift way of giving a subcutaneous formulation. So the study was a comparison of Isatuximab IV to subQ flat dose OBI plus Pomadex, as you can see on the study design. I'll pass this. So the baseline characteristic across the two groups were pretty much the same. To note, the OBI subQ group had more patients with worse kidney function, more patients with plasmacytomas, extramedullary and paramedullary disease, and more LDH. So possibly in the OBI group, you had subcutaneous group, you had more patients with the worst presentation of myeloma. So the first of the two primary endpoints was response rate, overall response rate. And you can see here that it was about the same across groups. Now, it's a non-inferiority study. The objective is to demonstrate that the Isatuximab subcutaneous OBI formulation is non-inferior to the IV. And you can see that the lower margin boundary had to be above 0.839, and you can see that it is above 0.839, it's 0.903. One of the secondary endpoints was VGPR and beta response rate, and you can see that, again, the subcutaneous formulation is non-inferior to the IV. The second of the two primary endpoints was PK, a PK endpoint. It was what we call the C-trough at the steady state. It's requested by FDA. It's a pre-dose C-cycle D1. Again, you can see that the Isatuximab subQ is non-inferior to the Isatuximab IV. It's interesting, the Isa subQ flat dose 1400 milligram, 10 milliliter, is actually above, but it meets the criteria for non-inferiority. Now, the pharma company Sanofi has decided to use a flat dose at 1400 milligrams. And you know, the flat dose is very interesting for the pharmacists, for the patients, for the nurses, for us physicians. But it's important, the flat dose, to understand that it has to work and to be active in terms of activity, efficacy, response rate, but also in terms of PK data for patients that could be very light, less than 65 kilograms, 40, 45 kilograms, as well as to patients above 80, 85, 100 kilograms. And you can see here that the response rate was approximately the same across all body weight subgroups, which proves that the flat dose shows the same activity depending according to the patient being very heavy versus very light. When you look at the same the PK analysis, C trough, now early on, C2 day 1 pre-dose, very early on, because you want that PK analysis to be done and analyzed, because the activity of the drug must be very early on. So you want the PK to be very good very early on. And you can see here that there's non-inferiority, but most importantly, you can see that across all body subgroups, body weight subgroups, again, the OBI flat dose, 1400 milligram dose of Isatuximab, covered all types of body weight subgroups. A very important secondary endpoint was the satisfaction of the patient. And it's important to note that this sub-Q formulation must be much more better appreciated than the IV formulation. And you can see here how not only it was largely more appreciated, 70 versus 53.4 in ITT, intent to treat, 96.8 versus 70.8% in patients that responded to the quality of life questionnaires. So not only was overall better, but the patients that were very satisfied actually were largely greater in numbers and percentages than the IV formulation. Another very important issue in regards to subcutaneous flat dose is that the objective is for the treatment to be meant to be ambulatory, very easy, possibly at home in countries where it's allowed and available and possible to give at home. So you need an initial, at first injection, infusion reaction to be very minimal. And here you can see it's 1.5% of the patient who had essentially grade 1. So it's very reassuring, because it means that you can give the sub-Q as an outpatient clinic or at home very safely and securely for the patients. To note, it was 7.5% with daratumumab. So this OBI sub-Q formulation seems to be very safe, actually, maybe possibly safer than a manual push. If you look at the local reaction, because we keep injecting the patient subcutaneously, so you may have local reactions. And you can see that the local reactions were very minimal, 0.4% of all injection, 4.2% of all patients. Safety summary, 2 safety summaries, the pharmacovigilance and the materiovigilance. Pharmacovigilance, Isatuximab sub-Q, no difference versus Isatuximab IV globally, but for the infusion reaction, and much better. Materiovigilance is a device reliable. Can you trust the device to not fail, never fail, or not creating any issue to the patient? You can see that only 9 patients, 3.4% of the patient had pain at the site of the needle injection. But the remaining patient, and for the number of more than 5,000 injections, the patient felt that that needle was really, really less painful than the usual needle we use. I'll pass this because it has to do with Isatuximab, and here we want to talk about the subcutaneous OBI on-body injector formulation. So you can see here that overall, 99.9% of the administration with the OBI were completed without any interruption. Overall, median duration was 13 minutes. But again, remember, the objective is not to say to patient, it's going to be done in 13 minutes. The objective is to say that it's going to be done in 97.9% within 20 minutes. The median is 13 minutes. But then if your skin is very smooth, it'll be faster. If your skin is maybe very thick, it might be slower. But in 20 minutes, it'll be done for 97.9% of the patients. As a summary, IRAKLIA is a phase 3 study that was built for non-inferiority and that met the non-inferiority. Isatuximab subQ, OBI, flat dose 1400 milligram is non-inferior to ISA IV. Same level of efficacy and PK data. The flat dose showed adequate exposure for all body weight subgroups, 1400 milligram, 10 milliliter of Isatuximab subQ. Higher satisfaction, I would say largely higher satisfaction for that subQ OBI compared to the IV method. And on top of this, I want to add that there is a parallel study called ISALCO. ISALCO looked at OBI subQ versus manual push subQ, different from IRAKLIA that looked at OBI subQ versus IV. And in ISALCO, it was demonstrated that the quality of life was much better with the OBI than your manual push. To finish the conclusion, similar safety profile, no unexpected safety signal, markedly lower incidence of infusion rate, excellent tolerability of OBI. So, IRAKLIA is the first myeloma phase 3 study to incorporate the use of an innovative hands-free OBI designed to maximize practice efficiency and patient convenience. These data should support the use of Isatuximab subcutaneous OBI formulation as a new standard of care administration for patients with multiple myeloma. And so, as a clinician, I hope that this will be available in my country for all the regimen using Isatuximab, so we can switch all our Isatuximab regimen from IV to subQ formulation using this on-body injector. And with this, I'll thank you very much for your attention.